What is going on, veterans, military service members, transitioning service members? Thank you for tuning in to another episode of the Off the Battlefield podcast presented by Veterans Claim Servants. I'm super stoked to be with you today. And before I get started, I always want to thank you for your service to our country. You matter a lot and keep in the fight. We are veterans serving veterans. Make sure that you like, subscribe, comment, hit that notification bell, keep this thing running, send this to a veteran or somebody that can use this help to get the benefits, resources, education that you need or that they deserve to be in the best position to win their claim for the benefits that they have earned due to their service to our country. Today, we are going to be discussing what is the Disability Benefits Questionnaire, aka the DBQ. So again, thank you for tuning in, and I'm going to get right into it because I do not like to keep people waiting too long. Okay, so I want to start by saying, and this is going to be in the description of this video, what is a DBQ, right? Um, a DBQ is a disability benefits questionnaire, right? It is a form used by the VA to document the medical conditions of veterans seeking disability benefits. So, for every condition that you have, whether it be mental health, whether it be musculoskeletal, whatever it may be, when you go to that compensation and pension exam, that's what that examiner is filling out as a disability benefits questionnaire, right? So, you can submit in your claim. It can go to a VSR or to a rater. And if you don't come with a DBQ by your maybe primary care doctor or a private provider, then you're definitely going to get a CMP exam. And when you get that CMP exam, that's what they're doing is filling out that disability benefits questionnaire. Okay. But I want to tell you some of the rights that you have as a veteran. And there is a lot of power in the disability benefits questionnaire as long as that disability benefits questionnaire is filled out right. If it's not filled out right, you might as well take a piece of paper, crumble it up, throw it in the garbage. But the Disability Benefits Questionnaire is a form used by the VA to document the medical conditions of veterans seeking disability benefits. These standardized forms are designed to provide specific medical information that the VA needs to evaluate the diagnosis, severity of your symptoms, and negative impacts of a veteran's service connected disabilities. Okay. So, how severe is it? Remember, the VA rates off of a GHA scale, which is the Global Health Assessment Scale, and it's based off of occupational and social impairment. Okay. DBQs are completed by a medical professional and help streamline the VA disability evaluation process, ensuring that the necessary information is consistently and accurately recorded. So once you have that compensation and pension exam, that's why you don't want to lie, but you don't want to minimize. And remember, you may have a purple heart, but if you sell yourself short, then you're just selling yourself short. If you minimize, that examiner is only going to know what you tell them. So it is your responsibility to make sure that you let them know, look, out of a 30-day period, I'm missing work 3 to 5 days. My conditions, whatever condition you've applied for, is this bad. Here's what's happening. Here's how it's impacting me occupationally and socially, right? Because remember, this is replacement income, right? If you got to take time off of work, if you got to go to an appointment, right? This is separate than your retirement, right? It's separate than your Social Security disability. This is due to a service connected issue that happened that is hindering you today and is impacting your quality of life occupationally and socially. It's impacting your relationships. It's impacting your ability to work. It's impacting certain jobs that you can get, all of that. So you need to keep that in mind. And a lot of veterans, I know they hate talking to the VA and the VA screwed me over and they're a pain in the butt and all this stuff. But look, if you don't articulate, you're just screwing yourself. Okay. So I want to get into some key points about DBQs, right? There is number one, condition specific, right? Each DBQ is tailored to a specific medical condition or body system. For example, there are DBQs for musculoskeletal conditions, mental health disorders, and many more, right? There are currently 69 DBQ forms available in the public domain. You can Google DBQ and you can find that DBQ and you can look at what they're asking for, right, on that. There's the standardized format. DBQs are standardized forms that ask detailed questions about various aspects of a veteran's medical condition. They cover diagnosis and they cover ICD codes, as well as symptoms, severity, and the negative impacts on work, daily life, and your social functioning, right? They are completed by healthcare providers. DBQs can be filled out by VA healthcare providers, VA contract examiners, or hear this, private healthcare providers, nurse practitioners, physician assistants, right? And medical doctors, psychologists, psychiatrists, board certified can complete DBQ forms for veterans. The forms must be signed and include the provider's credentials to ensure validity, right? For certain DBQs, there is telehealth acceptance, like mental health. DBQs completed via telehealth are also acceptable for rating purposes and are evaluated with the same standards as those completed in person, right? Roll-in VA claims, DBQs play a crucial role in the VA disability claims process. They provide detailed medical evidence that helps the VA determine the appropriate disability rating and benefits for you, the veteran, right? And then at claim submission, DBQs are not required to submit. You're not required. You don't have to submit a prepared DBQ with your VA disability claim. However, sometimes it can really, really help you, especially if you provide it from a doctor that sees you regularly, right? Or if the VA you feel has rated you low and it's just not being fair, you feel like, okay, my PTSD is worse. I'm only at 10% or 30%, or that you minimized before and just sucked it up and dealt with it. And you're like, I'm tired of that. First, I would make sure that you have the treatment to back up the DBQ, especially if you're going to send in a privately prepared DBQ, right, with your claim submission. And most likely that would be with a supplemental claim, because you're providing new and relevant evidence. But let's say you're at 10 or 30% for that PTSD, then you want to submit in that DBQ, right? You want to, if you submit in that DBQ, you're going to be coming with some of the ammo to the firefight, okay? And it's going to be a little bit more arsenal in your tool bag. So you can do that. But let me say this, make sure that you get the proper help with somebody that knows what the heck that they're doing. Just because your doctor is your primary care doctor, make sure that they know what they're doing. If you're using somebody outside, make sure that your medical evidence and your treatment matches up with what's being put on that DBQ. If not, when the rater gets it, what do you think they're looking at? They're going to look at that disability benefits questionnaire. They're going to have to consider that as part of the evidence and as new and relevant evidence if it is, or as original evidence if it's an original claim that's submitted. However, if it doesn't line up with the treatment and it doesn't line up with the medical evidence at all, then there's going to be question there, and then you're going to probably get you're going to get a CMP exam most likely, right? Now, if you submit up a disability benefits questionnaire, right, are you going to get a CMP exam? That depends on the rater that picks up your file, and it depends on various factors, right? Why would you get a CMP exam if you have submitted a disability benefits questionnaire? Because there's a lot of fraud going on. We've been seeing that circulating around. There's a lot of fraud. Sometimes people are just not being honest, unfortunately, and sometimes maybe some doctors are submitting things that are not honest as well. So there has to be checks and balances because we get paid off of the taxpayer dollar. So there's got to be checks and balances. If not, everybody could throw it in whatever they want to throw in. There could be a bunch of lies and a ton more people at 100%. Okay, not everybody's 100%. Everybody needs to be rated where they need to be rated accordingly. That's my opinion on that, right? But providing detailed and standardized information, DBQs help streamline the VA disability claims process, ensuring that, you, the veteran, if you're a veteran listening to this, receive a fair and accurate assessment of your condition. Okay. Now, the VA does have stringent requirements for the sufficiency of examination reports, ensuring that all reports are comprehensive, suitable, accurate for determining disability ratings. Okay. So, you know, I want to go back to you have the right to submit a DBQ with your VA disability claim, but make sure that that evidence lines up with that disability benefits questionnaire and don't come out of your pocket if someone is not looking at all the correct medical evidence. If they're just willing to fill it out and just throw it up, don't do that. Don't do that because that can end up just wasting your money and it could end up hurting you in the long run. There are instances when submitting a DBQ can be beneficial, right? And again, I just explained some of that, but again, they are completed by private healthcare providers and are adequate for rating purposes, despite what others might say. Sometimes you'll hear, "Why did you get that filled out?" People have went into a compensation and pension exam and been asked, "Why did you have this filled out?" Why? Because it's part of my right, and I want to bring as much evidence as I possibly can. You got to realize, as a veteran, or if you're in the military now, right now, and you're going to be getting out in the next couple of years or retiring soon, you need to build up your evidence. That is huge. Okay. That evidence, you can't refute. Okay. That evidence is key. That treatment is key. But it's also, um, don't listen to what others say that you can't have a DBQ submitted with that. Look, the more evidence that you have, it's not going to hurt you. It's only going to help you. But again, make sure that it's accurate, make sure that it's truthful, make sure that your records have been reviewed, and just make sure that whoever's filling it out knows what the heck that they're doing. Because if they don't, it's going to mean absolutely nothing. It's also important to note that the VA does not apply the treating physician rule, whereby the evidence of a treating physician is generally entitled to more weight than evaluations made by consulting physicians or expert witnesses. Um, so, opposite the popular belief, DBQs completed via telehealth are acceptable for VA rating purposes and should be judged by the same standards as in-person exams. But it depends on the DBQ that you are using. If it's musculoskeletal, or for your back, you need to have range of motion, determined. You need to be seen in person. There's no way to get range of motion via telehealth. But if it's migraines, if it's chronic fatigue syndrome, maybe it's IBS, PTSD, any of the mental health conditions, that can be done via telehealth, and they need to see you via video as well, especially if you use a private outside doctor. So I want to let you know, in the description of this video, there are good, safe, board certified psychiatrists and psychologists, and we have, we have connections with um, doctors that can write good musculoskeletal and your physical need DBQs and do nexus letters for you in the description of this video. That way you can ensure that you don't get screwed over. You can just get some of the proper help that you need to make sure that you're in the best position. They will take a thorough look. They will let you know the medical records that are needed and see if they can help you out. They're not just going to wing up something for you, but they're going to see if they can do it without charging you. They're going to see if it makes sense to be able to do it. Okay. So Dr. Prashant, Dr. Lopez, these guys are in the description of this video. You can also email me. I just want to make sure that you're in the best position um, to win your claim and to get the proper help that you need and not get screwed over. I don't benefit from it in any way. I just want to make sure that you, if you're listening to this and you need a nexus letter or a disability benefits questionnaire, that you get the proper help. There's a lot of shadiness going on around here, and a lot of companies out here who are doing a lot of shadiness, right? So I want to talk about the authenticity of DBQs. DBQs should generally be accepted at face value unless there is a reason to question their authenticity. Indicators of potential inauthenticity or fraud include discrepancies in the provider's contact information, unreasonable distance between the provider and veteran's residence. Keep in mind that the DBQ might have been completed via telehealth. Okay, so that's fine. Again, mental health or something like that, that's okay, but just make sure that the evidence was reviewed. Make sure that that's articulated in the statement. Make sure that that's put in your DBQ. Conflicts with the overall evidentiary record or signs of improper alteration. Claim processors may not dismiss a privately completed DBQ without a justifiable and documented reason. Qualification requirements for examiners. Specific qualifications are required for examiners in various fields: psychological examinations, TBI examinations, hearing loss and tinnitus examinations, right? Requirements for the reports are: examination report should use DBQ specific to the condition being evaluated. If it's your back, musculoskeletal, if it's mental health, the proper DBQ form has to be used. And again, there are 69 of those forms for different illnesses or different claims that you are submitting. It must include a diagnosis, medical history, objective findings, diagnostic testing results, and remarks. And it must clearly document the disability's cause and severity. Okay. Evaluating disability diagnosis must be clear and unambiguous. If additional studies or tests are required, they must be performed before the diagnosis can be considered final. Non-committal diagnoses are non-sufficient for rating purposes. It's important that you know that. Again, this will be in the description of this video so you can read through this as well. And also, can you, the veteran, or if you need, are you able to accept the fee-based examiner's DBQ or Nexus letter? There's no prohibition against accepting a VA examination report from a fee-based examiner who has previously submitted a statement on the claimant's behalf. You can do that. It's no problem at all. And a special note is please refrain from noting in your CMP exam notes that the veteran obtained a DBQ or Nexus letter that they paid for. Remember, you are also a fee-based examiner. Consistency and fairness are essential in these evaluations. And the VA may accept an examiner's conclusion that an opinion is speculative if adequately justified. Otherwise, additional clarification or a new examination may be required, right? So what I want to wrap up with this is privately prepared DBQs can be adequate for VA rating purposes if they meet the VA stringent requirements for completeness, examiner qualifications, and truthful, honest authenticity. It is crucial for veterans and their advocates to understand these requirements to ensure that their DBQs are accepted and to avoid unnecessary delays in the claims process. If you need assistance or anything like that, I'm just letting you know that there is qualified, honest, integral, board certified psychologists and doctors in the description of this video that can absolutely help you. And it's super important to know that your rights as a veteran, that you can use a private outside healthcare provider if they have reviewed your records and if they know what they're doing. You want to make sure of that. Make sure that they're credible, that you can submit that in with your claim or your supplemental claim. Remember, higher level review, there's a mistake or a discrepancy and you're just speaking to a senior level reviewer, so you cannot submit new evidence. I do not want to insult your intelligence, but a supplemental claim or a brand new claim, you can provide a DBQ from a private healthcare provider, right? And I also want to answer these questions. The Disability Benefits Questionnaire, again, I want to wrap up. These are some very common questions. What is a DBQ and why is it important? That's what we've discussed today. A DBQ is used by the VA to document the severity and nature of a veteran's disability. Does the DBQ guarantee approval of your VA claim? No. Submitting a DBQ with your disability claim does not guarantee approval. A DBQ is just one piece of evidence that the VA reviews to determine your eligibility for disability benefits. Do you need to submit a privately prepared DBQ with your VA claim? No, you don't. However, it can be that additional evidence that you need to just go through to get your claim done and to expedite it. Should you submit a DBQ with your VA disability claim? It's not required, but DBQs completed by private healthcare providers can be very, very helpful for increasing claims if you feel like you were rated low. And it's also possible, though not guaranteed, that a DBQ submitted with your claim could be rated by the VA without the need for a separate CMP exam. Again, that's not a guarantee because of fraud and checks and balances. Can non-VA healthcare providers complete DBQs? Yes, they can. What are the signature requirements for DBQs completed by non-VA providers? They must include their signature, printed name, credentials, IPI number, area of practice, all of that stuff, or their NPI number, their national provider identifier, right? And their medical license number. Are telehealth examinations acceptable? Yes, they are, depending on the type of claim that you have filed, right? And what should be done if a DBQ is found to be insufficient? If it's deemed to be insufficient, claims processors may contact the certifying provider to resolve any issues or request additional examinations to obtain the necessary information. Can a DBQ be dismissed if it appears inauthentic? A DBQ cannot be dismissed without a justifiable and documented reason. If there are indicators of inauthenticity, further validation or a VA examination may be required. Are DBQs completed by veterans who are healthcare providers treated differently? No. DBQs completed by veterans who are also healthcare providers are reviewed under the same criteria as those submitted by third-party providers. And then what happens if an examiner states that an opinion would be speculative? The VA may accept a speculative opinion if it is adequately justified. Otherwise, additional clarification or a new examination may be required. It's a lot of information. I don't want to beat you to death with this, but that is what a DBQ is today. We have discussed what is a DBQ, who can fill that out. Remember, it is different than a Nexus letter. In this next video, I will be getting into what is a Nexus letter and what's the difference between a Nexus letter and a Disability Benefits Questionnaire. Again, you aren't required to submit a DBQ. However, it can help you in certain cases. If you need help with getting it filled out properly and you don't have a doctor that can do it, in the description of this video, there are doctors that you can reach out to. Their emails are here. I don't get involved in that. I'm very unbiased with it. I just want to provide people that will not screw you over and just take your money. You're not a dollar figure. Don't go to any companies that are doing anything illegal. Don't do any of that. Make sure that you're doing things and getting help the right way. Make sure that you're getting the proper help that you need to be in the best position to win your claim. So, veterans, I just want to thank you for tuning in. Make sure that you like, subscribe, comment, hit that notification bell, share this out to someone that can use this help. And thank you for tuning in today to another episode of the Off the Battlefield podcast presented by Veterans Claim Servants. We are veterans helping veterans, and thank you for your service. And every Wednesday morning, 7 to 8 a.m. Eastern Standard Time, right? If you need a community, you can join us for VCS Unity Hour. It is online. The description for the link for VCS Unity Hour will be, the link will be in the description of this video. So thank you for tuning in. We appreciate you. Until next time, I am out. Peace.